my name is Justine McKinnon, and this is for my radiology class for discussing on how to properly position a dog for a hip x-ray when it comes to OFA or pen hip. This is my little man Moose, so we're going to go ahead and use him today. As you can see, I already have our proper attire on. Once again, we do not have gloves here, like I said earlier. So we're going to go ahead and get the proper measurements. First, we're going to go ahead and put him in lateral. And then go ahead and use the calipers here. So for him, we're getting about 23 centimeters right there, and then we're going to quickly put him in VD. Do the same exact thing. And then for here, we are getting about 18 centimeters there. However, like I said before, we do not use the calipers here. We go based off of weight on all of our patients, so I already have it set for the KV of 125 and MA of 2.5. Okay, so once you have your patient in VD position, what you're going to go ahead and do is go ahead and pull his legs out, okay? And then you want to make sure his rear limbs are extended and parallel to each other, and rotate his stifles internally because you want to make sure everything is symmetric. And then once you have a good view here, you're going to go ahead and take the shot. When it comes to the pen hip x-rays, it's a little different. They require 3 views total. You first have the distraction view, the compression view, and the hip extended view. The hip extended view is actually what I just shown you, and what that does, it actually checks for possible signs of osteoarthritis. You have the distraction view. It's okay, no man. You have the distraction view, which basically you want their legs sticking straight up as if they were standing on their own. And then for the compression view, you want them basically in a frog-like position, which of course he's not sedated as we would like him to be, but what you would try to do, if he was fully sedated and relaxed, you would get a frog view just like this. As for the OFA studies, you want to go ahead and it's for the detection of the assessment and of the hip joint irregularities and secondary arthritic hip joint changes within the breed or each certain breed of dog. Like I tried to show you earlier with Moose, for instance, it's normally best that they have some sort of chemical restraint. Here we normally use a mixture of like ACE and Torb or otherwise dexdomitor, because what you want is to have them to the point where their muscles are completely relaxed, but you don't want them fully sedated per se, but you just want enough where you can just manipulate the joints and whatever else you would need for them in regards to that. But normally we just use a mixture of ACE and Torb or otherwise dexdomitor. Another thing that you want to make sure you do is actually storing everything permanently in our system here, because what OFA requires is permanently identified with the animal's registration number, name, date of the radiograph was taken, which veterinarian did it, and also registration number or a tattoo of that particular patient. For large breed and giant breed dogs, we normally use a 14 by 17 film size is recommended for OFA standards. If you need to make a copy per se, you would insert 2 films into the cassette prior to making the exposure, which will require about 15% increase of the KVP to make an exact duplicate of the radiograph sent to OFA. Basically, good contrast is desirable, so high MAs and low KVPs and good techniques are recommended for all large breed dogs, because if it's not good enough per their standards, basically it would send it back right to you, and you would have to go ahead and repeat the radiographs again. But once the radiologist has those radiographs, normally they take about 3 radiographers to go ahead and look at that. And what they look at are approximately 9 different anatomical areas, such as the craniolateral acetabular rim, the cranioacetabular margin, the femoral head, the fovea capitis, the acetabular notch, the caudo-acetabular rim, the dorsal acetabular margin, the junction of the femoral head and neck, and the trochanteric fossa as well. And they also do briefly 7 classifications for heritability, so 7 classes total for each given breed of dog, which basically they rate from excellent, good, fair, borderline, mild, moderate, all the way up to severe. Okay, so there's also the pen hip view. pendant view at a glance is basically to measure and interpret hip joint elasticity, or laxity, excuse me. You have the distraction view, compression view, and the hip extended view. The distraction view is basically like I showed you with Moose. They're basically in a neutral standing position, so their legs are actually held straight up in the air. You have the frog view, that's for the compression view, and also the hip extended view, which is when the femur is pulled into extension. For the distraction view and the compression view, those are used to obtain accurate and precise measurements of joints, laxity, and congruity, and the hip extended view is used to obtain supplementary information regarding the existence of osteoarthritis.